In cases of childhood obesity, it's a serious issue, so let's go ahead and bring in ABC News medical correspondent Dr. Darien Sutton. Good morning.
Good morning. So the rates of obesity have increased significantly when the CDC established this report and reported this report for the past 20 years. I just want to show you some of the numbers. So when they look back to the 1990s, back up until 2023, they found that the rate of obesity for children 2 to 19 increased to more than 20%. That's 1 in 5 children having a diagnosis of obesity. For severe obesity, that rate increased as well. It went from about 3.6% to 7%. Now that's double in the rate.
That's a really surprising number.
Yeah. Significant. When we ask why, we can look to what are children eating. We talk about things like highly processed foods, high sugar beverages, a lack of a sedentary or more of a sedentary lifestyle, more screen time. But there's also social determinants. We're seeing that this is very much a sign of economic prosperity. Children are becoming farther and farther away from their supermarkets, and that's also an issue that we need to understand and figure out how to fix.
So what should parents consider if their child or teen falls into that category, especially for young kids which getting them to eat healthy food is tricky anyway?
Very tough.
I think when you're establishing that conversation, it's really important to focus on health, not on how that child looks, because this is not only an important topic, but it's a sensitive one that's associated to much stigma. Also, talking about their eating habits, you want to make sure that you practice what you preach. As parents, you want to make sure that you're getting under that healthy lifestyle just as much as you want your child to. Encouraging participation into sports. And then when you're talking to their provider or their physician, I think it's also important to ask about medical conditions that can lead to their state or their weight. And I think it's really, honestly, it means a multimodal approach to making sure that you're tackling this problem from all angles.
And while we have you on a similar topic, but a little bit different, let's talk about some of the weight loss drugs that are out there. There's a new headline involving those drugs and substance abuse, and there could be some help.
This is fascinating. So this found that with those who use these GLP-1 medications, Ozempic, Wegovy, Mounjaro, tirzepatide, semaglutide, they found that there was an associated reduced risk of alcohol binge, and they also found that there was an associated reduced risk of overdose from opiates. Now, why is this? Very much because often these medications mimic hormones that help you feel satisfied after you eat. That same pathway is operated in addiction, and so this can open up many opportunities for the future that are really exciting.
Is more research needed on that, or there's enough to say what you've already...
Great point. There's a tremendous amount of research that has to be done. This is an association, so now we work to find the cause and effect.
All right. Dr. Sutton, as always, thank you so much. Appreciate it.
Of course.